As we promised, this is Frockel's show, and we said we always are there to inform, to share, and educate. And today we are on health matters. Are you struggling with discomfort, itching, or pain down there? You are not alone. Millions of people suffer from hemorrhoids, commonly known as piles. A condition that's uncomfortable, sometimes painful, and often misunderstood. But don't worry. In this video, we will explain everything you need to know about hemorrhoids, including what they are, what causes them, their symptoms, potential complications, and most effective treatment options, from home remedies to medical procedures. Let's get started. The first question we ask ourselves is, what are hemorrhoids? Hemorrhoids are swollen veins in the lower part of rectum and anus, similar to varicose veins you might find in your legs. They occur when pressure increases in the rectal area, causing veins to stretch, bulge, and sometimes bleed. There are two main types of hemorrhoids. The first type is called internal hemorrhoids, which occur inside the rectum. These are usually painless, but may cause bleeding. The second type is called external hemorrhoids, which develop under the skin around the anus and can be itchy or painful. Then what causes hemorrhoids? The main cause of hemorrhoids is increased pressure in the lower rectum. This pressure can come from several sources, including straining during bowel movements, sitting too long on the toilet, chronic constipation or diarrhea, a low fiber diet, obesity, pregnancy due to pressure on pelvic blood vessels, heavy lifting, aging as tissues naturally weaken. Basically, anything that puts strain on your lower rectum can contribute to hemorrhoid development. Then we look at the symptoms of hemorrhoids. How will you know that you have hemorrhoids? The symptoms of hemorrhoids can vary depending on the type and severity of the hemorrhoid. The most common symptoms include bright red on toilet paper or in the stool, pain or discomfort during bowel movements, itching or irritation in the anal region, swelling around the anus, and a lump near the anus, which may be sensitive or painful. Internal hemorrhoids might go unnoticed until they bleed, while external ones are often more painful and uncomfortable. Then we look at complications of hemorrhoids. We normally say that although hemorrhoids are usually not dangerous, they can lead to some complications if left untreated. Some of the complications will include thrombosed hemorrhoid, when a blood clot forms, causing severe pain and swelling. And then we have chronic blood loss, leading to anemia in some cases. Then we have prolapsed hemorrhoid, where internal hemorrhoids push through the anus. And then we can also have infection, especially if the skin is broken. Then we have skin irritation or hygiene issues due to persistent itching and discomfort. Then why do we need to treat hemorrhoids? Proper management is important, even if the symptoms seem mild or fast. Then we quickly look at the possible treatments of hemorrhoids. The good news most hemorrhoids can be treated and even prevented with lifestyle changes and medical support. Let's look at your options. The first options we look at are the home remedies and lifestyle changes. Just change your lifestyle and some home remedies. And this will include increased diet fiber, fruits, vegetables, whole grains, drink plenty of water, use stool softeners if needed, don't strain during bowel movements, avoid sitting on the toilet for too long, warm sitz bath 15 to 20 minutes several times a day, and over-the-counter creams with hydrocortisone or witch hazel pads. Then we have the other treatment option, which is non-surgical medical treatments. In this case, we have rubber band ligation, cuts off blood supply to shrink the hemorrhoid. Then we have sclerotherapy, that is an injection to shrink the vein. Then we have infrared coagulation, which uses heat to reduce the hemorrhoid. The treatment option number 3 is surgical treatment for severe or persistent cases. In this case, we have hemorrhoidectomy, which is surgical removal, which is most effective. And then we have stapled hemorrhoidopexy, pulls prolapsed hemorrhoids back into place. Most people don't need surgery, but if your hemorrhoids are large or recurring, a procedure might be the best long-term solution. Then we have prevention tips. And here is how you can keep hemorrhoids away from coming back. Number 1 is you eat a high fiber diet. And then number 2, stay hydrated. Drink a lot of water. 3, don't ignore the urge to go. In other words, if you feel the urge to go to the loo, don't ignore. Exercise regularly to prevent constipation. And then maintain a healthy weight. Avoid sitting too long, especially on the toilet. Simple changes in your daily routine can make a huge difference. But then, when you try home hygiene and all the conditions at home, at times you need to know when to see the doctor. In case one has hemorrhoids, when should one think of seeing the doctor? Many hemorrhoids clear up on their own or with self-care, but if you experience persistent or heavy bleeding, severe pain, a lump that doesn't go away, symptoms that don't improve in a week, then it's time to speak to a healthcare provider. They can rule out other conditions like anal fissures, abscesses, or even colorectal cancer. Hemorrhoids may be uncomfortable, but with the right care and knowledge, they are manageable and often preventable. If this video helped you, give it a thumb up, subscribe for health content from our YouTube channel, Flock Show, share it with your colleagues who may also be in need of the information, and give us a comment to tell us what you need to hear more from Flock Show. Thank you so much for visiting our YouTube channel and giving us your feedback through comments and likes. Let us stay safe, let us stay healthy by knowing and managing conditions such as hemorrhoids. Thank you so much.